So an epidural, it's an anesthetic technique that we use for patients in labor, where we place a small tube, a small catheter in the lower aspect of a patient's back. And through that catheter, we'll deliver numbing medicine and near those nerves that are responsible for that intense pain associated with contractions during labor. And we block those nerves with medication. Almost all women in labor are candidates for safe epidural placement. There are some exceptions, so patients who have maybe a bleeding disorder, they're unstable for some reason, they have active systemic or localized infections, some sort of medical condition that maybe, or psychiatric condition that prevents safe epidural placement. There could be some contraindications there. And that's what the anesthesiologist will do when they assess you, is to make sure that an epidural is a safe option for you. If you choose to have an epidural anesthetic, you can be rest assured that an epidural is safe for your baby. The amount of epidural medication that's actually absorbed into a mother's bloodstream is so minuscule. And so an epidural won't be the reason why a patient will have depressed breathing, or even the baby will have depressed breathing. In fact, when you compare it to IV medication, epidurals are generally associated with less system-wide side effects. And epidurals are also safe for patients who wish to proceed to breastfeeding as well. Once it is established that you're in active labor, you can actually ask for an epidural at any time. There's really no requirement that you must be dilated to a certain number of centimeters before you have to request before you request an epidural. If labor has progressed to the point where you aren't able to remain relatively still for 10 or 15 minutes, for the epidural to be placed, or you potentially are starting to push and delivery is imminent, it may be too late at this point for an epidural. But again, your anesthesiologist and OB will discuss and sort of collectively make that call. So the simple answer is no. One misconception that we have with labor epidurals is that they increase the rate of C-sections. The most recent and up-to-date studies have actually shown that epidurals do not increase the rate of C-section, and the ACOG and the ASA, which are the governing bodies of both associations of OBGYN and anesthesia, they've made a joint statement regarding this actually, and they basically state that the fear of epidurals causing unnecessary C-sections is basically unfounded. Permanent nerve injury, especially paralysis, is an exceedingly rare complication. The reason that it is exceedingly rare is because of where we actually place the epidural. So the epidural is always placed below the level of the spinal cord, and is typically placed before the spinal cord is reached in the epidural space. Again, in medicine, the risks are never zero, but we want to look at the risk to benefit ratio, and the risk of paralysis is extremely, extremely rare. The most common side effect that we see in epidural placement is what we call hypotension, or a drop in the mother's blood pressure. It usually occurs right after we place the epidural and right after we load that initial medication through the epidural. But we can make sure it's of little or no consequence by prehydrating the mother with IV fluids. And if blood pressure were to drop, nonetheless, after an epidural is placed, we can easily treat it directly with hydration as well as medications that help increase the blood pressure back to normal levels. There are other side effects like itchiness. Some of the medications that are in the epidural solution may cause itchiness. Another side effect is a possibility of nausea. And on a rarer occasion, some patients may have what we call a post-dural puncture headache. And so it's good to look out for if you were to have a headache after an epidural placement, because it could be due to a continuum of cerebral spinal fluid leakage. And just let your nurse know, let your doctor know. It's directly treatable, and your anesthesiologist will be able to go ahead and assess you, diagnose you, and treat you appropriately. Again, it's always important also to remember that anytime we introduce needle to skin, there's always a remote risk of bleeding, a remote risk of infection or tissue damage. That's why it's really important to not only do epidurals on appropriate candidates, but to do them in strict sterile fashion. Placing the epidural can take anywhere from 10 to 15 minutes, upwards of about 30 minutes to maybe 40 minutes sometimes. It depends. Sometimes patients have scoliosis, they could be obese. Sometimes more time just may be required to place the epidural. Actually, we have a good video on anesthesiameds.com about the placement of an epidural, so you should definitely check that out. But what we do is we sit you up so we have access to your back. We wash off your back with sterile solution, place a drape. We numb your skin. It feels like a bee sting. Then you'll probably start to feel a little pressure as we approach the epidural space. Once we're into the epidural space, we thread a small catheter that we then test and then tape to your back. Through that catheter, medicine will go through that tubing and continuously maintain pain relief throughout the rest of your labor until you deliver your baby. And we're able to keep that catheter in for epidural in for days if we need to. Say in case you have a C-section and we need to give you post-operative pain control, we can leave it in place as well. Once placement of an epidural is complete, basically you'll only feel like you have tape on your back. Your lower half of your body will become numb. The contractions will start to feel less strong and hopefully easier to manage. You'll still probably feel some pressure, but that sharp pain associated with contractions will certainly subside quite a bit. And remember, we don't want you totally numb during labor, because at some point your participation will be needed to sort of push the baby out. And we can also program a pump that will help a patient actually take control of their own pain control throughout the labor process. We call that PCEA, or patient-controlled epidural analgesia, where we actually give a patient a pump or a button to press in case they need an extra dose of medicine along the way. So the choice is yours. What your anesthesiologist is there to do is to give you all the information you need to decide basically whether the benefits of an epidural outweigh the potential risks for you. And what we're here to give you is accurate information that you need to make a decision. And if you choose not to have an epidural, we'll be on standby to support all the needs that you may have throughout your labor process. Say in the need that you may have a C-section, we'll be right there for you. So, but overall, yes, if you're a safe candidate, I certainly believe that there are advantages of having an epidural. Epidurals are certainly amongst the most effective of all pain relief options for women in labor. They have the least amount of, say, like drowsiness for mother, and safe for baby, and they're versatile. So in the case that you do need to proceed to a C-section, we can use your epidural to give you stronger medicine for surgery and help you stay awake for the birth of your child. And in general, basically, having less pain means less anxiety and a better, safer experience. So, I mean, there's emerging evidence that epidurals also help with things like postpartum depression and post-traumatic stress disorder, chronic pain conditions, things like that. But again, it's your personal decision. And as your anesthesiologist, we're simply here to make sure that you have the best and safest experience that you can have in delivering your baby. Hope this information helped. See you next time.